Dr. Mwanza, I've been hearing so much about neurotransmitters lately. Everyone keeps talking about dopamine and serotonin like they're the kings of the brain. What's the hype all about?
Great question, Doc Scenario. Dopamine and serotonin are two of the most clinically relevant neurotransmitters in psychiatry and neurology. Let's start with dopamine, known for its role in pleasure, motivation, and movement.
Dopamine, that's the one people call the feel-good chemical, right?
Exactly. But it's more than just good vibes. Dopamine affects drive, psychosis, Parkinsonism, attention, motor control, inhibition of prolactin, and narcotics. You can remember it with the mnemonic dopamine. Drive overactive equals psychosis, Parkinsonism, attention, motor inhibits prolactin, narcotics, enjoyment.
Wait, so it's involved in both attention and movement?
Right. That's because dopamine operates in multiple pathways in the brain. Number 1 mesolimbic pathway, reward and psychosis. Number 2 mesocortical pathway, attention and cognition. Number 3 nigrostriatal pathway, movement control, and number 4 tuberoinfundibular pathway, inhibits prolactin secretion.
So in Parkinson's, the nigrostriatal pathway is the one that breaks down.
Bingo! Parkinson's disease involves degeneration of dopaminergic neurons in the substantia nigra. That leads to rigidity, tremor, and bradykinesia.
And in schizophrenia, it's the mesolimbic pathway going haywire.
Correct again. An overactive mesolimbic dopamine system is linked to positive symptoms like hallucinations and delusions. That's why antipsychotics block dopamine receptors, especially D2 receptors.
How about the reward system? What's dopamine doing there?
The nucleus accumbens is the brain's pleasure center. Dopamine release there reinforces rewarding behaviors, whether it's eating, sex, or substances like cocaine or heroin.
Ah, that's where addiction comes in.
Yes, and that's why narcotics hijack the dopamine system. They increase dopamine in the nucleus accumbens, leading to that euphoria and reinforcing behavior.
So dopamine is like the brain's hype man.
Haha, I like that. Just make sure your hype man isn't doing too much. Too much dopamine leads to psychosis, and too little causes Parkinson's.
Alright, let's switch gears to serotonin. I've heard it's linked to mood, but is that all?
Not at all. Serotonin is involved in a wide range of physiological functions. You can remember its effects with the mnemonic head, red, fed. Head, mood, anxiety, thinking, sleep. Red, platelets and bleeding. Fed, appetite and GI motility.
Let's unpack that. Head, first.
Yes. In the brain, serotonin regulates mood, anxiety, and sleep. That's why stress, selective serotonin uptake inhibitors, are used to treat depression and anxiety disorders.
And, red, what's the connection to bleeding?
Serotonin helps platelets aggregate. So when serotonin levels are blocked by stress, it can increase the risk of bleeding, especially gastrointestinal.
Interesting. And, fed, refers to digestion.
Correct. Most of the body's serotonin, about 90%, is actually found in the gastrointestinal tract, where it helps with motility. That's why drugs affecting serotonin often cause nausea or diarrhea.
So serotonin is a multitasker.
Absolutely. It even plays a role in sexual function. Low serotonin levels can increase libido, but high levels, like with stress, can reduce sexual desire or delay orgasm.
I guess it's about balance, then.
That's the key in psychopharmacology. Too much or too little can cause dysfunction. For example, low serotonin is associated with depression, anxiety, and OCD, while excess serotonin can lead to serotonin syndrome, a potentially life-threatening condition.
What's serotonin syndrome like?
Think autonomic instability, neuromuscular hyperactivity, and altered mental status, like confusion, agitation, hyperreflexia, and fever.
How about the brain structures behind all this?
For dopamine, remember the ventral tegmental area, VTA, and substantia nigra. They're the origin points for those dopamine pathways we discussed. For serotonin, the key area is the raphe nuclei, located in the brainstem. It's the main source of serotonergic neurons.
Wow, dopamine and serotonin are like the brain's project managers. One hypes things up, the other keeps the mood and G track running smooth.
Exactly. And understanding these two lays the foundation for everything else in psychopharmacology. Get these down, and you're halfway there.
Serotonin syndrome, that sounds serious. What does that look like?
It's very serious. You can remember it with the mnemonic shits and shivers, sarcastic. Shivering. H. Hyperreflexia, increased temperature, hyperthermia. T. Tremor. S. Sweating. And S. Spontaneous clonus. H. Hypertonia. I. Increased bowel sounds, diarrhea. V. Vital sign instability, especially hypertension. E. Encephalopathy, confusion. R. Restlessness. S. Seizures.
That's intense. So a patient on multiple serotonergic meds starts sweating, shaking, confused, maybe with diarrhea, you gotta think serotonin syndrome.
Exactly. It's a medical emergency, and recognizing the signs early can be life-saving.
Doctor, Mwanza, I'm back, and today I'm ready for a double dose, norepinephrine and acetylcholine. Let's go deep.
Ah, the classics of the autonomic nervous system. Let's start with norepinephrine, also known as noradrenaline.
Let me guess, it's all about the fight or flight.
Exactly. Norepinephrine is the primary neurotransmitter of the sympathetic nervous system. When you're being chased by a lion or cramming for an exam, norepinephrine floods your system.
So heart rate increases, pupils dilate, and you forget you're hungry.
Spot on. The effects are all about survival readiness. We remember this using the mnemonic 8, H for heart rate increases. A for arterial pressure rises, T for temperature increases. E for eyes dilate.
Got it. Hate keeps me awake and alert. But where does norepinephrine come from?
Great question. Neuroanatomically, norepinephrine is synthesized primarily in the locus coeruleus, a small nucleus in the pons of the brainstem.
I've heard of that. Locus coeruleus, the blue spot.
Yes! Rich in pigmented neurons and a critical player in arousal, attention, and stress response.
So norepinephrine is your brain's espresso shot.
Exactly. But when there's too much norepinephrine, or an overreaction of the system, you get symptoms like anxiety, hypertension, tachycardia, sweating, hypervigilance.
Hypervigilance, that always-on, edgy feeling.
Yes. And when you're withdrawing from stress or SNRS, serotonin and norepinephrine levels suddenly drop, leading to withdrawal symptoms. That brings us to the mnemonic shits and shivers.
Shits and shivers, that's graphic, but memorable. Hit me with it.
Shits stands for S. Sleep disturbance. H. Headache. I. Irritability. T. Tremors, sweating. Shivers stands for S. Shivering. H. Hyperreflexia, increased temperature. V. Vital sign instability. E. Encephalopathy. R. Restlessness. S. Sweating again.
That's a lot of sweating.
Yes, because norepinephrine revs up your sympathetic tone. Now, let's contrast that with acetylcholine.
Ah yes, acetylcholine. I've heard it plays both sides of the autonomic field.
Indeed. Think of A as acetylcholines, because it works through two receptor types, muscarinic and nicotinic.
Muscarinic for parasympathetic, nicotinic for somatic and CNS.
You've got it. Muscarinic receptors dominate in the parasympathetic nervous system, the classic rest and digest, or feed and breed, state.
So we go from lions and hate, to hammocks and relaxation.
Exactly. And to remember the signs of cholinergic overactivation, we use the mnemonic sludge M. S. Salivation. L. Lacrimation. U. Urination. D. Diaphoresis. G. Gastrointestinal upset. E. Emesis. M. Meiosis.
SLUDGEM sounds like someone ate bad seafood.
Or got exposed to organophosphate poisoning, which increases acetylcholine by inhibiting acetylcholinesterase.
Got it. So antidote.
Atropine, an anticholinergic that blocks muscarinic receptors.
What about nicotinic receptors?
They work at the neuromuscular junction, causing skeletal muscle contraction. Also found in the CNS, they help with memory, learning, and attention.
So when I smoke nicotine, I'm hitting those receptors.
Yes, and stimulating a dopamine release cascade. That's why nicotine is addictive. Nicotinic receptors equals Nick at the gym using his muscle memory.
Visual mnemonics always hit. What about in disease?
In Alzheimer's disease, cholinergic neurons degenerate, especially in the nucleus basilis of Maynard.
That's the brain's choline capital, right?
Exactly. To remember it, the nuclear base of Maynard is sweating to remember the codes before a launch.
To recap, norepinephrine equals fight or flight, made in locus coeruleus, mnemonic, hate, withdrawal, shits and shivers. Acetylcholine equals rest and digest, to receptors, muscarinic, sludgem, and nicotinic, muscle memory, attention, neuroanatomy, nucleus basalis of Maynard.
Brilliant summary, Doc Scenario. That's how you lay the neural foundation.
Dr. Mwanza, I'm ready to tackle histamine and opioids today. Let's dive deep into these two, shall we?
Absolutely. Doc Scenario. Two fascinating and clinically significant neurotransmitters. We'll start with histamine. When most people think of histamine, they think allergies, right?
Yeah, like sneezing and itchy eyes. But I know it's not just for allergies.
Correct! Histamine is also a neurotransmitter, and it has major effects on alertness, sleep-wake cycles, and cognitive function. It's primarily located in the tuberomammillary nucleus of the hypothalamus.
Wait, the tuberomammillary nucleus. That's a mouthful.
I know, right? But it's a crucial area for histamine synthesis in the brain. This nucleus controls the arousal and alertness needed for wakefulness.
Ah, so it's like the brain's natural coffee, keeping us awake and alert.
Exactly. And when you block histamine, that's when the sedation kicks in. That's why antihistamines like diphenhydramine, Benadryl, are often used to put people to sleep.
Speaking of antihistamines, how do we remember what they're good for?
Ah, good question. Use the mnemonic antihistamines H help with insomnia, stomach acid, and allergies.
Nice. So, H is for insomnia, S is for stomach acid, and A is for allergies.
Yes, that's exactly it. Let's break it down. I for insomnia. Histamine promotes wakefulness, so antihistamines like dazolamine are used for sleep aids. S for stomach acid, H2 blockers like cimetidine and ranitidine reduce stomach acid. For allergies, histamine is a central player in the allergic response, causing itching, rashes, and nasal congestion.
Got it. Now, what happens when you block histamine receptors in the brain?
When you block H1 receptors in the brain, you get sedation. This is why first-generation antihistamines like diphenhydramine cause drowsiness. They can cross the blood-brain barrier and affect the CNS.
But second-generation antihistamines like loratadine, Claritin don't cross the blood-brain barrier, right?
Yes, they only target peripheral H1 receptors, which is why they're less sedating. So, you get allergy relief without feeling drowsy.
Okay, I'm feeling good about histamine. But let's switch gears to opioids.
Ah, opioids? Now that's a topic we need to spend time on. Opioids are powerful because they bind to opioid receptors in the brain and spinal cord, and they're excellent for pain control.
So, opioids are your go-to for analgesia.
Yes, analgesia is the primary function of opioids. But they also have some dangerous side effects. Opioids bind to the mu, kappa, and delta receptors in the brain and spinal cord. The mu receptors are the ones responsible for most of the pain relief, but they also contribute to respiratory depression.
Respiratory depression sounds serious. That's why opioid overdoses are dangerous.
Exactly. When someone overdoses on opioids, they may stop breathing entirely, which is often the cause of death. The mechanism is that opioids depress the respiratory center in the brainstem, making the patient unable to sense the rising CO2 levels.
I've heard about Ondine's curse in this context.
Yes, Ondine's curse refers to the inability to automatically breathe while asleep, which can be a result of severe opioid overdose. Now, let's break down the mnemonic to remember the key effects of opioids. It's ARMC.
ARMC, I like that. Hit me with it.
A for analgesia, pain relief. R for respiratory depression, acute danger with opioids. M for meiosis, pinpoint pupils, a classic sign of opioid intoxication. E for euphoria, a sense of well-being, often leading to addiction. D for drowsiness. Sedation is common with opioid use. C for constipation, a frequent side effect, so stool softeners are often needed.
C. That's an easy one to remember.
Yes, it's very helpful when differentiating opioid effects. Now, let's talk about opioid receptors in a bit more detail.
I know the mu receptor is the most important one for pain relief, right?
Exactly. The mu receptors are also involved in euphoria and addiction. When you stimulate them with drugs like morphine, you get both analgesia and a sense of bliss. But over time, the brain adapts, leading to tolerance and dependence.
And the kappa receptors are more involved in dysphoria and hallucinations.
Yes, kappa receptors are less involved in pain relief and more in negative effects. They can contribute to nausea, dysphoria, and psychosis in some cases.
So, if I'm using opioids for pain, I want to focus on the mu receptors.
Yes, and with drugs like fentanyl, which binds strongly to the mu receptor, you get potent pain relief, but the risks of overdose are much higher.
What about opioid withdrawal?
Withdrawal is a serious issue. When the body becomes dependent on opioids, stopping them can lead to symptoms like restlessness, muscle atrophy, nausea, sweating, dilated pupils.
So, withdrawal from opioids feels terrible.
Absolutely. And here's a mnemonic to help you remember the signs of opioid withdrawal: no more fun. And for nausea, for ongoing pain, for muscle aches, for frequent yawning, for unrest, and for nasal stuffiness.
Wow, I'll never forget that. And for opioid overdose, you'd administer naloxone or naltrexone.
Exactly. Those are opioid antagonists that reverse the effects of opioids, especially respiratory depression. It's a critical life-saving intervention.
Okay, let's quickly review. Histamine, involved in alertness, wakefulness, and cognition, made in the tuberomammillary nucleus of the hypothalamus. Mnemonic, antihistamines help with insomnia, St. Omach acid, and allergies. Opioids, analgesia, respiratory depression, meiosis, euphoria, drowsiness, constipation, with receptors, mu, kappa, and delta. Mnemonic, C.
Perfect! You've got it all locked in. Histamine and opioids are complex, but with these mnemonics and neuroanatomy, they're easier to master. Welcome back, Doc Scenario. Today we're diving into two of the brain's most critical neurotransmitters, glutamate and GABA. These two are like the brain's on and off switches. Let's start with GABA.
Yes, when I think of GABA, I immediately picture the most boring lecturer, someone who just gabs on and on. It's like that guy who talks for hours and makes me fall asleep. That's exactly what GABA does to the brain, right? It's inhibitory, like the off switch.
Spot on, Doc Scenario. GABA is the primary inhibitory neurotransmitter in the brain. It works by reducing neuronal excitability, promoting relaxation, calmness, and slowing things down. It's the perfect counterbalance to excitatory neurotransmitters. You're right, GABA shuts everything down and helps prevent seizures, anxiety, and agitation.
So, it's like the brain's way of saying, okay, that's enough. Let's take a break. And those GABAergic medications, like benzodiazepines and barbiturates, are used for treating anxiety, insomnia, and seizures, right?
Exactly. GABA is a key player in managing stress. Benzos like diazepam, Valium, are GABA agonists that calm the brain down. Barbiturates, too, enhance GABA activity, but with more risk for sedation and dependence.
I remember GABA's role well because of the mnemonic. GABA is like a GABA who just goes on and puts everyone to sleep. Makes it easy to recall that it's the brain's off switch.
That's a great mnemonic. It captures GABA's role perfectly. Now, let's flip to glutamate, the brain's excitatory neurotransmitter. If GABA is the off switch, glutamate is the on button, pushing the brain into high gear.
So, glutamate basically makes sure the brain stays awake and alert, right? It's like the gas pedal for the brain. But what exactly does it do? Drive. Mwanza.
Correct. Glutamate is crucial for learning, memory, and overall neuroplasticity. It's involved in almost every process in the brain where an active response is needed. It binds to several types of receptors, including NMDA, AMPA, and KNET receptors, all of which enhance neuronal firing and synaptic transmission.
Wait, NMDA, that sounds familiar. Isn't that important for learning and memory consolidation?
You're absolutely right. The NMDA receptor is central to long-term potentiation, LTP, which is a key mechanism behind memory formation. Without glutamate signaling through NMDA receptors, we wouldn't be able to learn or retain new information.
I see. So, glutamate is the brain's amplifier, making sure the signals are strong and clear. It's like cranking up the volume on your favorite playlist to ensure you don't miss a beat.
Exactly. Doc Scenario. And glutamate does this through several receptor types, like the AMPA receptor, which helps in faster signaling, and KNET receptors, which are less understood but still important for excitatory signaling. But, too much glutamate can lead to excitotoxicity, which is harmful to neurons. It's a delicate balance between excitability and inhibition.
So, too much glutamate can lead to neurodegenerative diseases, like Alzheimer's, or even seizures due to overstimulation. That's where GABA comes in again, keeping things in check.
You nailed it. The balance between glutamate and GABA is vital for maintaining normal brain function. If glutamate gets out of hand, it can result in brain damage and contribute to diseases like Parkinson's, Alzheimer's, and even schizophrenia.
So, the balance between these two is crucial for mental health. Now, can you remind me about the mnemonic for glutamate?
Of course. You can remember glutamate by the mnemonic. Glutamate is involved in memory and thought. So, whenever you think of glutamate, think of it as the key neurotransmitter for both memory and thought processing.
That's a solid mnemonic. It really helps me link glutamate to cognition. Now, what about GABA's neuroanatomy? Where does it mainly act in the brain?
GABA is found throughout the CNS, but it's particularly concentrated in areas like the cortex, hippocampus, and basal ganglia. It plays a huge role in modulating excitatory neurotransmission and maintaining inhibitory control in the brain.
So, in the hippocampus, GABA helps with memory regulation, while in the basal ganglia, it's all about controlling motor activity, like preventing seizures or involuntary movements.
Exactly. GABA in the basal ganglia helps fine-tune motor control and prevent excessive movement. A GABA deficit here can contribute to disorders like Parkinson's or Huntington's disease, where motor control is compromised.
Got it. And what about glutamate's neuroanatomy?
Glutamate is widespread, too. It's found all over the brain, but it's particularly important in the cortex for higher cognitive functions, as well as in the hippocampus for learning and memory. It's also critical in areas like the thalamus and spinal cord, where it helps transmit sensory and motor signals.
So, both glutamate and GABA are involved in maintaining the brain's overall activity levels. One keeps things firing up, while the other puts the brakes on when necessary.
Absolutely. It's a constant push and pull to maintain balance. Without one or the other, the brain wouldn't function properly.
Dr. Mwanza, thanks for all the insights. It's like each neurotransmitter has its role to play in the brain's orchestra, glutamate playing the trumpet to get things going and GABA acting as the conductor to keep everyone in line.
Well put, Doc Scenario. That's the essence of neurotransmission.